well. So in the interest of time and to be respectful for all of you, and for those of you who I don't know and I haven't addressed you personally, I apologize about that, but we're still thrilled that you're here, even if I haven't called you by name, because I don't see a name on the picture. I see pictures in some cases, but not names. There's Betty. So now that Laloma is here, we're ready to move forward, huh? And I first need to issue an apology. We scheduled this coffee, which have great interest from people, right on top of a meeting over at the Colonnade. So we typically have quite a few people from Colonnade dialing in for these because they enjoy these topics, and we missed this time. We just dropped it right onto another meeting. So my apologies, I own that one, and it won't happen again because we want everybody to hear this great information. So I've been talking. I should probably introduce myself just so that you realize that I'm more than a talking head, huh? My name is Gina Orr. I'm Chief Philanthropy Officer at Sun Health Foundation, and I'm so thrilled that all of you are here. And I'm just going to minimize this for 1 second. If Joyce can help me with that. All right. Oops. Bear with me while I get my mouse moving correctly. Okay, there we go. Okay, thank you. Okay, so 2021, this is our third Coffee with Gina of the year. We're so thrilled that some of you are repeat joiners. We love that. We love that. And we're also designing some new topics and some interactive topics for going forward. I'll talk a little bit about that towards the end of our presentation today. I think everybody can hear me because I've gotten nods and thumbs up and smiles and mutes. So glad to have all of you here. We will keep you muted during the presentation so we don't get the feedback. But if you have a question while Joel is speaking, please give us a wave and Joyce can unmute you so that you can ask your question. Because we really like to have this a conversation, and all of you have participated so beautifully that way. And we look forward to that. Thank you very much. You know, this notion and the mystery of telemedicine is so intriguing. And of course, Joel is the expert in that area. In our last coffee talk on this subject in January, we talked about the basics of telemedicine. And, you know, we looked at things like, what is it and how does it work? And how might it impact my medical care? What are the benefits? What should I expect? There was great conversation and dialogue, and Joel did a great job walking us through all that. So we hope that in today's conversation, you'll continue to learn about patient outcomes, as well as patient experience, remote monitoring, care for chronic conditions, and more. Your questions are always welcome. So I'm grateful again to introduce you to Joel Barthelemy, the founder and CEO of GlobalMed. He is our guest speaker for this second time on this topic. Based in Scottsdale and Fort Lauderdale, GlobalMed powers the world's largest, most advanced virtual health programs by designing and manufacturing integrated software and hardware telemedicine solutions that support patients at any point in the continuum of care. As we shared in January, Mr. Barthelemy is also a past member of the Sun Health Board of Directors, and so we're grateful for people like Joel who volunteer their time to help Sun Health and the Sun Health Foundation family to be educated and informed and to learn more. This really does focus on our mission of championing superior health care and well-being through philanthropy, inspired living, and wellness programs. So we look forward to answering your questions as you have them, and please be thinking about them so we can pause and Joel can answer those. So we've witnessed, is it time to turn on to Joe? No.
We got one more slide.
Okay. Sorry about that. We witnessed a fantastic example in the advancements of medical care with technology right here in our own backyard at the emergency department over at Banner Boswell. Last fall, that project was completed and it opened, and it's amazing. And I would love to take any of you there for a tour of it sounds odd to say that it's a beautiful emergency department, but it really is. And the donor wall is just breathtaking and striking. So generosity from the community has really built that new emergency department that is available to everyone. And you may have heard me say before that about 80% of the admissions into Boswell come through emergency. 50% of those are typically heart related. So in the new tower, there will be 3 new cath labs where Dr. Kathuria and his expanding team can provide the best cardiac and thoracic care to anybody who might need that. So anyway, great things to come there as well. So now it gives me great pleasure to introduce Joel. Hello and welcome to part 2 of Demystifying Telemedicine. So this is Joel Barthelemy to take it from here. Joel?
Thank you, Gina, and thank you everyone at Sun Health and everyone that's tuned in today. It gives me great pleasure to share a little bit about what I spend my life doing and have done so for the last nearly 20 years. And so it is it's a great honor. And today we're going to talk about telehealth in action. So about a month ago, we talked in part 1 about how telehealth has become a normal part of healthcare. It's so embedded today in the medical landscape that in 2020, nearly 1 in every 5 visits with a healthcare provider actually took place through this type of virtual visit. It's often called, as we talk, telemedicine, telehealth, e-health, m-health, virtual health. It goes on and on. But we learned a little bit about some of the names called for telehealth and telemedicine. We also talked about virtual health can cover simple conditions like an eye infection or the flu, but can also be used for complex and what we call evidence-based care, such as treating skin cancer or heart disease or diabetes. Data-driven devices like HD cameras and stethoscopes, ultrasounds and other devices can actually interface with the electronic health record directly so that that data makes it through your record and you have it in the future. This does help you, the patient, and me, the patient, receive the evidence-based care while ensuring that the providers have access to the full healthcare story. So if you went to an urgent care for something, if that urgent care uses an EHR or electronic health record or electronic medical record, we can make sure that that data is captured and then shared with your primary care physician down the road. And we don't end up with orphan information that is tough for us to remember when we go see our regular primary care. The benefits of virtual care include cost savings, better care coordination, and the improved outcomes for you and I as patients. It also brings care to the underserved and is used in schools, it's used in prisons, on oil rigs, research stations, even the space station, and the remote villages in our own state in Arizona at the bottom of the Grand Canyon for the Havasupai tribe. But then it's also used throughout the country of Zimbabwe for the people in the villages there, or Haiti, or many different places throughout the world. Obviously, this helps mitigate, using this technology helps mitigate the impact of what we call provider medical shortages, medical personnel shortages, especially in the rural areas. And it does allow for the flexibility of telehealth to reduce the thing called provider burnout. You may have seen some of that in the news where doctors and nurses, healthcare professionals, they're becoming burnt out because they're spending 18-hour days seeing patients, especially with COVID, right? Last time we also talked, next slide, we also talked about how telemedicine is helping John, a patient with congestive heart failure, and how he receives consistent care despite living hours away from his cardiologist. For John, he has to travel 4 hours round trip for each appointment, and that was just way too much of a burden for John. But his care team set him up a scale, a pulse oximeter for his oxygen, and a blood pressure monitor so they could get daily readings from John. We also learned about his daughter, Kristen, who lives in Chicago in the urban area, but was really unable to get to John for his visits, but she was able to get on virtually, like we're doing here today, along with the physician, the cardiologist, and her dad. And she did that from Chicago. This arrangement comes in handy, especially when his condition began to deteriorate. His blood pressure readings were creeping higher and his oxygen levels began to drop. Alarmed, his care provider and coordinator contacted him and arranged an in-person evaluation. At the appointment, his cardiologist realizes John's aortic valve needs to be replaced, and soon the surgery saves his life. And that's because of that little monitoring system that he had at home. COVID-19 means his daughter is not allowed to visit John in the hospital, but telemedicine lets her participate virtually in the daily care and the doctor's rounds, and to stay informed of her father's health. Kristen has become well educated on telehealth clinical capabilities at this point and feels confident seeking virtual care for herself. When she realized that she had a painful ear infection developing, she was concerned about it, and she was actually concerned about visiting her primary care physician and possibly exposing herself to COVID-19 in the waiting room. So her primary care physician actually agreed with her and did a virtual visit with her and was able to diagnose she actually had an infection in her ear and minimized her risk of contamination. So kind of cool things happening there with telemedicine and telehealth. So next slide. John's story touches on two common and very valuable applications about telehealth. Remote patient monitoring, right? That's what was happening with John and those devices. But also because John has chronic conditions with the fact that he had congestive heart failure, he had high blood pressure. So these multiple comorbidities that he had really fall under chronic care management to help John stay healthy. Remote patient monitoring can collect important patient health data like weight, blood sugars, vital signs, and when there's not a healthcare facility, that comes in really helpful to get that data. Usually the patient is at home or in some sort of long-term care facility and uses the devices to transmit the data to the healthcare provider. So even like in a long-term care, if the devices are attached, the staff gets alerted prior to just when they do their rounds. This is a really good way of medication adherence, making sure the patients are staying active in their treatment and following kind of their healthcare advice and their directions. This can also help patients have shorter hospital stays, avoid that skilled nursing facility or have a readmission, and receive more consistent care. Innovations in biosensing, wireless, and other technologies allow providers to guide their treatment plans for their patients and do so from a long ways away. Tying into the chronic care management, which goes hand in hand with remote patient monitoring, nearly half of all American adults have chronic conditions such as heart disease, hypertension, COPD, diabetes, or kidney disease. That's half of us, right? And these conditions drive the majority of the costs that we have in hospitals and the hospital visits. Patients often need frequent appointments when you have all of these different chronic conditions, which is costly for us, the patients, and it's very inconvenient if you think about it. And I'm sure some of you have had some of these inconvenient times that you have to go take care of your health, especially if you're living outside. If you think about it, if you're living outside Phoenix and you have to get into Phoenix to see your healthcare provider. Chronic care management in telehealth helps you and I and everyone receive the care we need from the specialist who otherwise isn't really available, especially like for me, I can get care here in Fort Lauderdale where I'm living, and I can still talk to my physician back in Phoenix. But if I needed a cardiologist, if I needed a specialist, even though I'm in an urban area, I still can use telemedicine to get me the care that I need today, right now. And this, when we look at the chronic care conditions and what we're able to do, uh, we need to reduce the amount of people that are actually going into hospital, especially when it's not needed, because it really does drive up healthcare costs. And I know for myself that I've ended up going to the hospital a couple times when I was a little too stressed. I thought I might be having some heart issues, and it strictly was stress and a needing to have a bicarbonate or a probiotic. And so it is something that is very expensive for us if we don't utilize the technology. It helps to keep the cost down and get us the care we need. Next slide. So far, we've talked mostly about how telehealth can benefit each patient, but telehealth is actually transforming healthcare outcomes on a large scale. Reaching the underserved is a big one. Patients in rural or remote areas can receive specialist care and focused medical expertise that wouldn't otherwise be available in their community. Instead of delaying exams and screenings, people are getting care in a more frequent way. The population health initiatives aim to treat widespread demographic patterns. Telehealth can change entire regions and community challenges by addressing those barriers related to economic challenges, historical trauma, environmental factors, and personal behaviors. Democratizing healthcare is also available and achievable with telehealth. Instead of access to care being a matter of privilege, people in every nation and socioeconomic class actually can have and receive the same world-class care. I tell a story about, and I don't know if I told it last time, about Bisbee. And so in Bisbee, Arizona, you have the hospital system there that called Copper Queen Hospital, and telemedicine transformed the town. And we've been working with Bisbee and Copper Queen for probably 15 years. They were one of our very first customers. What was so interesting was their population was declining, stores were closing, small businesses went away because every time there was any type of medical issue that was beyond a scrape or a cut, and they would go to the hospital room, the emergency room physician would send the patients to Tucson. And so they would either be airlifted, depending if it was maybe a cardiac issue or stroke issue, or if it was something else, they would put them in a transport if it was less life-threatening, but still very important. And so once they put in telemedicine there, the very first thing they did was cardiology. I think in the first year, so this is probably somewhere around 2008 or 10, where they, somewhere in that area, in using the technology, imagine in the first 6 months of using the technology, the first 6 months, they had 39 patients present to the emergency room with a potential heart attack. In the past, all 39 people were transported to Tucson. In the first 6 months of utilizing the technology, they kept 26 patients, and only 9 or 10 or 11 ended up traveling via helicopter or transport to Tucson. Now, the big benefit of that was the town now knew that they had care. And so the medical team, the CEO of the hospital, went from just having one modality of care, the stroke, or excuse me, cardiology, moved to neurology and stroke. Then they went to dermatology and cancer treatment. Then they went to pediatrics, and then they went to spirometry and pulmonology. So they have a whole host of specialties that are available in Bisbee at Copper Queen Hospital. Now, who's the biggest fan of the technology? The CEO of the hospital, because now his hospital operates in the black, not the red. And I think you've probably read about all the hospitals, the small hospitals around the country that are closing because they can't make ends meet. This hospital was operating very tight. They're now operating in the black because they have a thriving hospital. But the biggest fan is not the CEO. The biggest fan in Bisbee is the mayor. And why? Because her town has come alive. People are moving back into the area and the surrounding area. They have healthcare at their fingertips. And so businesses are opening, coffee shops, small businesses. Their town has come back to life. And if you get a chance to go down to Bisbee, I know they would love for you to come in and just say hi at the hospital, because their town is thriving again compared to where it was just 10 years ago. And that really took place within only a few short years. Because if you have small kids and you live there and you don't have pediatric care, you're driving 80 miles to get care. Right? If you're aging and you're worried about your cardiology issues, or just any of your hypertension or diabetes, you now actually have care in the town. And this happens all over the world. And that comes back to that democratizing of healthcare. It shouldn't really matter, where you are located. You should have access to care. It shouldn't matter what you have in your pocketbook or what kind of car you drive. You should have access to care. And part of our our vision that really is as a company and as individuals that I work with, our vision is to be part of a world without disparity of care. And so that's what we work for. And I'm sorry, I don't mean to plug, but that's our mission. That's what keeps us driving. And so let's go on to the next slide here.
Hey, Joel, could I just pop in for a quick second here with a question that I have in my chat box? Would you mind? Don't mean to talk over you. But I see a question that came to me from one of our participants asking, how do we find out if our doctor or doctors participate in telehealth? And also, does telehealth connect directly with our health insurance providers? So those are two excellent questions.
Absolutely. So on the first one, you have to ask your physician, right? You have to ask, do you have the availability to do a telehealth visit? And unfortunately, a lot of docs still will say yes, like mine did when I called and asked him about a prescription. And the nurse said, oh yeah, he does telehealth. I said, great. So I waited in my office in Phoenix for my doc to call, and I got a phone call. It was the nurse. I answered my phone, and there was my doc. I was talking to him, telling him what's been going on and how I've been feeling. And to me, that's not really telehealth. That's talking to your doc on the phone. When you're doing what we're doing here, and you have devices connected or information that a physician or a high level license can make decisions on, that's telemedicine, that's telehealth, right? That's the beginning of it. So you have to call and you have to ask. And if they don't, you are able to go online and do a query, a search for a physician that does do telehealth and telemedicine. You might pay $49 for that visit, but you will and have a doc that you can talk to and see, and they can see you, and you can take your phone and point it at at an area of concern. So it happens every day. It happens hundreds of thousands of times every single day. The VA is doing, I think, about 40,000 visits a day on video with patients, when just a year ago, before the beginning of COVID, they might have done about 4,000, maybe 2,000 or 3,000, 4,000 visits a day. So that's I hope that answered the first one. The second one, Gina, help me out. What was it?
The second one was, does telehealth connect directly with our insurance providers?
Yeah, so it can. It doesn't necessarily mean that the insurance company is going to be on that call. But if your doctor doing telemedicine is scribing or getting the data information into the EMR, then the EMR and hopefully the billing system that they use is connected to the through the EMR and through the billing system to your payer, to your insurance company. And insurance companies are getting real forward thinking. In the state of Arizona, the real benefit is that in 2021, from laws that were passed 2 years earlier, and then so 3 and 4 years earlier, is the fact that in Arizona, the benefit of pretty much just about anything that you can get paid by Medicare in telemedicine, it doesn't matter really what it is, can actually be paid by your insurance company as well. That there's the ability for it's actually mandated the insurance companies have to pay for it.
Hey, Joel, thanks for those answers. I'd kind of like to go back to the first one again, when you gave the example of you contacted your physician to inquire, do they do telehealth? And they said yes, and the nurse called. And so you're having a phone conversation with your doctor, which really is not high-level telehealth, because there's, you're really talking about monitors or perhaps even some exams or diagnostics or something that can take place remotely. So it's different. It's two very different things.
Yeah. Well, and this, is sometimes an opportunity for Sun Health at Home, where possibly Sun Health at Home, is, I don't know, Gina, is Sun Health at Home doing remote patient monitoring or chronic care at this time?
With COVID, we did do remote work. There was a lot of that, but there are some things in our healthcare journey that really have to be in person and hands-on.
Sure.
So it's blended.
Oh, yeah. Yeah. So, yeah, I would ask your physician if they do, and then if they say yes, ask them if it's just a phone call or if in fact is it going to be a video call, and then if they say, gosh, Gina, we need to get you on a monitor, or if you're having issues and you don't want to be running back and forth to the hospital, you should ask if you can get put on a chronic care system or a remote patient monitoring system. We have to be in charge of our healthcare today, and we have wonderful advocates like Sun Health that can help us navigate some of that area, right? I know that that's possible.
Yeah, absolutely. Your point about having advocates who can help facilitate those discussions and be supportive and even translate what's being said, because sometimes it's kind of out there. So I see another. Jane, did you have a question? Would you like to unmute? Or I think that's from Jane.
Yes, thank you, Gina. Can you hear me?
We can, yes, thank you. And then Jerry's next.
And thank you, Joel. Yes, I just wanted to compliment you on this product and model. It's for the greater good of the entire globe. And in addition to being so beneficial on countless practical levels, would you also say that it's going to be a cost containment benefit without question for both providers and also patients?
Absolutely. The sooner we get care, and if telemedicine helps us, if telehealth helps us get care sooner, we should have better outcomes, and we do have better outcomes, and the data's in, we do have better outcomes because we're getting care sooner.
Thank you, Joel.
No, thank you, Jane. Nice to hear your voice again.
Good to see you. Thank you.
Thank you.
Thanks, Jane. Jerry Solomon has a question for you, Joel.
Joel, I
Hello,
was
sir.
just
How
going
are
to make a comment to the listeners. When you call into your doctor to find out if they do telehealth, a lot of them now are having you download an app for your telephones. So you've got to be very careful. They do not know the difference between that and true telehealth. So you've got to be fairly pushy and inquisitive because there are different levels here that Joel's talking about. One is where you get a really comprehensive doctor's visit, and one is where you get a superficial one. And as far as they're concerned, they're both telehealth.
Right. Yeah, great point. Yeah, so here I'm in the business. I'll tell you one quick story. So one of my young marketing people had a sore throat, and so he called because our insurance company says, hey, before you go to the ER or before you go to the urgent care, call this teledoctor group, right? And so he did so, right? And to keep his costs down, he called and he shared that he is allergic to penicillin within the call. And the doc was just doing it again on the telephone. And so he, first of all, he filled out all the forms, and then he told the doc that he's allergic to penicillin, and then went on, and the doc prescribes him to go get the prescription at Walmart because that's where he chose. And so he gets to Walmart 2 hours later to pick up his prescription, and guess what it is? Amoxicillin. What is amoxicillin built on? Penicillin, right? And so again, so then he said, stop, I can't do that. And he called back to that teleservice. And again, he gets a different doc on the telephone, and he says, hey, I said I'm allergic to penicillin, and the doc, gave me penicillin through amoxicillin. And they said, oh, okay, well, here's the next prescription they gave him. And so we have to be careful, especially if it is, there's something that happens with a video connection that's better, I believe, and why we like it so much today than us all just being on a phone bridge right now with a PowerPoint, right? And so there are some very good benefits. Again, I just have to say, we are in charge of our healthcare, and it's very helpful to have advocates, whether they're family members, they're the people at Sun Health, to help us make sure we make the right decisions and get the right information. So Jerry, you're spot on that. Thank you. So
Are there any other questions before we go on to the next slide? I think this has been a great discussion and very informative. So Jane, Anna, Betty, Jerry, thank you for your questions. Are you ready to proceed, Joel?
Sure. I only have a couple slides left. I want to go back to John and Kristen, because this kind of puts it in context too. So the telemedicine has connected for John. It connected him to literally life-saving surgery because they were alerted, right? These healthcare providers were alerted. And he continues today to receive follow-up care remotely from his care team. The hospital implements a wide-scale program in that rural community to treat the many patients that they have with chronic conditions such as hypertension and diabetes and respiratory disease. The hospital also launches a virtual class and support groups helping residents adopt better nutritional habits. And I know Sun Health does that, and because I've been in the kitchen. And then the follow-up preventative care tips and to help John and others make lifestyle modifications. Over time, the changes add up with better outcomes across the entire community and even on a generational scale. When we look at his daughter, Kristen's telehealth journey takes a different direction. Now that she's experienced the benefits, she organizes a workplace telemedicine pod. So imagine that the employees now have virtual visits in the office that they all work in, and they don't miss hours of work having to run out to go see a doc, which helps the productivity, helps the company that they work for, and keeps their overall healthcare costs down. They can actually virtually conference in with their children's schools as well when their kids don't feel well, or the school nurse has a medication question. And that we're doing a lot in that area right now. It's a phenomenal area. If you think about all the people that do have hourly jobs, and when their son or daughter is something wrong, and today there's not nurses in every school, phone call goes to mom or dad and says, hey, you got to pick up little Johnny because he's feeling bad. He's not feeling well. And now with telemedicine, kids are staying in school longer. With telehealth, they're being able to stay in school longer because it's really not always get them out of school. The other benefit is that when you do have a school that's tied to a pediatric service, when they know when the pediatrician weighs in and they know what's kind of wrong with the child, they can diagnose it properly at the school. They call in the prescription, and the mom or dad on the way to pick up their child to take them home when they are sick can actually do the same on the same trip, pick up the prescription for their child as well. So it's really a wonderful benefit. And so Kristen's colleagues love the convenience. We do this in many different businesses across the country and throughout the world. And obviously the leaders of the company and the heads of the workforce love it because their people are more productive and there's less time off unnecessary, being taken unnecessarily, right? And so next slide. So now that we've kind of summarized where telehealth is right now, I want to just take a look at some of the future. And I touched a little bit on it last time. And, healthcare will become even more technological and virtual as it, much further beyond where it is today. And the Generation Z patients they're going to experience healthcare in the future so different than what we are today. We can expect even more advances in the future. And I want you to imagine where all your vital signs, your blood pressure, your oxygen, your blood glucose, your weight, all of those are done automatically. And that data is alerting your local caregiver long before you are having a heart attack, because the trending is there and the data is there to know where your health is headed. You think about nanomedicine and the treatments for cancer, using nanobots in the repair of damaged cells and to somewhat correct genetic type deficiencies that we have. So there's all this technology that's taking place out there right now. Think of a microscopic robot. Get this, a microscopic robot implanted inside your son or your grandson, which sends alerts to the pediatrician who prescribes a genome-based drug therapy that is concocted for your grandson's biology. It's actually called precision medicine. It's not something that you would take or I would take. It's actually used for that individual and that individual only. Dr. Jeff Trent down at the downtown, I got to think of the name, it's escaping right now. Transgenomical. I can't say it today, but I am amazed every time I get a little time with him and we have breakfast and he goes through and shows me how they are prescribing exactly the combination of medicines for the genome-based and to the DNA of the individual. It's actually quite amazing in where it's going, and then yes, ma'am.
I'm sorry to interrupt. That's fascinating, almost kind of scary, I think, if it gets into the wrong hands, perhaps. I don't know. I mean, I guess you can look at it a couple of different ways. Somewhat related to this, Joyce, could you unmute Anna? Because she has a question, about security and some different information. I'd love for us to have that discussion if this is a good time to do that, Joel.
Sure.
Anna, I think you're unmuted.
Oh, she has to.
Oh, can you unmute yourself, Anna?
Can you hear me?
Yes, we can.
Well, I'm a little bit concerned with so much of our computerized data. Much of it is personal data in the case that we are talking about, which is medical information private to each one of us. And I wonder how this data is protected from those who try to access it. And has there ever been a data security incident?
Sure. A great question, Anna. So yes, there have been situations where I know of one case where a spouse hacked the insulin monitor on their spouse and gave it false data in hoping of the detriment of their spouse. And that person was prosecuted. And so there is a huge outreach on cybersecurity and for healthcare devices, and for the FDA to allow for the devices to be used. And so I know personally on several of our customers, the amount of protection that has to be built in to the technology. And that means not only the software, but the hardware device itself and how it connects, right? So some institutes some customers we deal with will not allow a Bluetooth device to be operating within their confines because they believe Bluetooth can be hacked. Now that's a military application. They won't allow Bluetooth, but there is, this is such a real concern and problem for us all, is that data security. And I think it goes beyond just our personal health information. That's what HIPAA and HIPAA High Trust is supposed to protect, right? Is our personal information, that electronic medical record or electronic health record, that no one has access to that. Now, I think it's interesting because they kind of are relaxed those rules when it comes to COVID, right? And so there's all sorts of discussion going on in Washington about having a passport or not having a passport, mandatory passport or not for COVID, because it does violate our HIPAA concerns, right? And so, and if you remember, HIPAA came out I think in the like the mid 80s, end of the 80s, and it was all about, at the time, it was really driven by AIDS. And I'm getting off topic here a little bit, but it was driven by AIDS because you weren't supposed to be discriminated against because it was happening if someone thought you had that disease, right? And so the Portability Act and that security took place. Those laws for HIPAA are only getting stronger. They took a little bit of a reduction or lax during COVID so that we could do video conferencing, or doctors could do video conferencing, but those rules are bouncing back and they're getting stronger and tighter. But there's another thing called NIST 866, and that is super secure on all of the data coming from devices and for the cybersecurity side. So that's a badge of honor if your technology has that, because then you've gone through great lengths to make sure it's secure. Every line of code, every vulnerability possible is looked at and checked and mitigated so that you have security. I think we'll see more and more in the days to come, weeks and months, of violations of that security of the technology, or products like this that we're on that are hacked. Not saying that this one, but something like this, right? And so you are right to be concerned. And I would always say you always have to work with reputable. You want the best doctors working with you, and you want the best technologies empowering those docs.
Thanks, Joel. Appreciate that. Great question, Anna. Thank you.
Yes, I think Jerry's got a question.
You do, Joel. Where are we at on the compatibility of telehealth systems and networks?
Okay, do we have a couple more hours?
You take it, Joel. You go.
Yeah. So, more and more compatibility cross systems is happening, and so you'll see it more on the video side that a video call on Zoom may not work with a video call on Microsoft Teams or Cisco WebEx, and so. I think that, Jerry, it's a great question. I think it's still a little ways out. There is the Uniform Communications, the UC consortium, UCC, that I know is out there trying to get these technologies to talk to one another. But it's hard to be secure unless everybody's on the same secure either FIPS or HIFISMA or the type of encryption, because if you're on a Zoom call and you want to talk to somebody doesn't have Zoom, but they have Microsoft Teams, to have that crosstalk between the two applications. So I think it's still a ways out there, and everybody's trying to become the most important video product, and then they get to dictate the rules. So I think it's a little bit longer. As far as the EMRs goes, our electronic medical records, you've got multi-billion-dollar companies that want to protect their turf, and Congress keeps trying to legislate and has put some legislation in place of that information being able to be shared. So if, for instance, if you're getting, your wonderful healthcare at Banner down the street, but you came from Connecticut and Bob's doc in Connecticut still isn't concerned about Bob, and he wants his well-known physician that's known him for the last 30 years to weigh in, but he's on a different EMR. You have what's called the health exchange in each state, and that data is supposed to go up to the health exchange. And I know Banner participates, and supposedly and basically your doctor, Bob, that you're still dealing with in Connecticut could literally have that information shared to the Connecticut exchange and get that data.
Well, as a follow-on, then what I hear you saying is somebody at a fairly high level is going to have to bring larger networks together. Does that mean this could become an issue, the insurance companies sponsoring like your company and saying, okay, everybody that's under our insurance plan will be able to use this type system?
That is obviously the hope, and we're working with Blue Cross Blue Shield in Arizona, and to provide hopefully care out to the Navajo Nation or anywhere within the state where it's like we talked earlier about the disparity of care that takes place in highly rural areas. One of the other things, and to that point, is to how do you have a remote patient monitoring device, a blood pressure cuff or the scale, the pulse oximeter, your oxygen content? How do you get those to get on a network when there is no network, right? And so we are working closely with a company that actually has all the devices, pretty much all the devices that are completely cellular. And so if you can pick up a cell phone and get a signal, even a flip phone, get a signal, these devices actually get a signal that is a fraction of that and gets the data up to your doctors, right? So yeah, Jerry, it's a great question. Back to your question is, it's going to be a while before everybody desires and actually plays nice in the sandbox.
Thanks, Joel.
Thank you, Jerry. Well, I really could, talk about this ad nauseum, as you can kind of tell. So I don't have anything more to share unless you have more questions. And if I, if I have any data on it, I can be happy to answer.
Let me see if anybody has any questions. You can type something in, or you can raise your hand and unmute and ask the question of Joel. I think it's been a fascinating discussion. Mr. Colley, it looks like you're wanting to ask a question. Oops, you're muted.
No, I don't have to.
Oh, okay.
Anna's got a question, Gina.
Oh, okay. Thanks, Jerry. Anna, you have another question?
Yes, I'm just wondering if there is some paperwork that you might want to share with us, because when you listen, and it's good to hear it all and it makes sense, but it takes me a little while to absorb things, and I like to do some reading. So if you have something in paper form, I, for one, would truly appreciate it.
Yes, and so Gina, can I share my website?
Absolutely, you bet.
Okay, so it's GlobalMed, GlobalMed, globalmed.com. And so there, if you go to, I believe we have a whole area on white papers. We have stories, we have videos, gosh, a ton of videos that will take you to YouTube, and it'll take you to Ghana and the systems that are being used in Ghana. It'll take you to Puerto Rico. Literally takes you around the world with different installations of the products, right? And how it's changing care. I wish it was a better website. I wish there was more information. But another site that you can go to, which is all of my competitors participate with, and I'm going to look it up here right now to make sure I give you the right URL. It's for the American Telemedicine Association, and so I didn't do it right here. Funny, I should know this better. Okay, so it's called AmericanTelemed.org. So AmericanTelemed.org, and there's news, events, communities, resources, membership, and you don't have to become a member. You can just literally read some of the different peer-reviewed studies and different stories about how telehealth and telemedicine is really changing, has changed the world already, and is going to continue to change it.
Thank you.
Yeah, thank you, Anna. And it was nice to see you again.
Good to see you.
Okay, well, this has been fascinating. I'm unmuted, right? Oh, this has been fascinating. Thank you, Joel. Just amazing. You've piqued my interest so much in this in many ways. I just appreciate your willingness to come back to us to share this with the group today and others, and just, keep us informed, and so we can be informed about our own health. Thank you very much. Thank you very much. So,
Honored. Thank you.
you are most welcome. So, it really does align with Sun Health and our ongoing efforts to provide superior health care today and in the future. We really are grateful to all of you who have supported the Generosity for Generations campaign. That community support makes possible new advancements in medicine. You hear these very smart people trying to reach more people and creating these wonderful products and devices to connect. It's just amazing. And again, this community has been amazing as well, because the goal of the campaign is to provide these programs and services for the community because of the community. So your support really does make a huge difference. Some good news about the Generosity for Generations campaign. We're proud to announce that the campaign is currently at 67% of the $48 million goal. We have about 15 million to raise in about 15 months. So we're hard at it. And we love to take these pauses and these coffees and share information and get together with all of this. So a couple announcements that I'd like to make for the future. We are working on our May Coffee with Gina and Friends, and I believe we have 2 cancer physicians who will be coming on board to talk about skin cancer as we get ready to go into the summer. This will be something a little different this time. It's going to be a little more interactive, and it's going to be kind of themed around a fact or fiction quiz that will frame their presentation. It'll be a lot of fun indeed. So we thank our team member Stephanie for bringing that suggestion to us. So it'll be, look for those dates. It's either going to be the 14th or the 21st of May. And because of some conflicts that we're trying to avoid, we'll start it at 9 o'clock instead of 9:30, but it'll be very, very interesting and it'll be a lot of fun. Also, next week on Saturday, April the 17th, we have our annual golf event. We have a few spots available. This is a very fun event that raises money to support the cancer projects that we have in the Generosity for Generations campaign. I am not a golfer, and it's kind of nice that my husband trusts me to have a club in my hand in the booth. And so we have a lot of fun with this. And you can be a spectator. You can just come and join in the fun. It will be outdoors, so we will be watching all of that, the restrictions to keep all of us safe. So hope that you can join us at this event. It's in Glendale at Top Golf. And then we're looking into the fall for a walkathon, Walk for Women's Health in the fall. So save the date of September the 26th at 9 o'clock. More details about that will be coming. We'll support Women's and Infant Services at Del Webb. And so it's been great to see the encouraging trends that we've learned. I think we've learned a lot from COVID. Some things have been hard to manage. Other things have been, oh, I can do that. But we're all being very careful with our safety protocols because our health is very important. And my name badge, I have my sticker that, yes, I have been vaccinated. And so I'm proud that I can be around people and not present something to you. And I hope that you have been vaccinated as well. We do encourage you to continue to wear your mask, wash your hands, keep socially distanced or physically distanced from each other if you're not fully vaccinated. We're so thrilled that our Sun Health communities, La Loma Village, the Colonnade, Grandview Terrace, are starting to open up for more visitors and expanding operations as well. We know that the bistro and the marketplace and the atrium, the dining facilities are just wonderful. So they have great, great food. So think about coming in for a cup of coffee and a visit and a nice salad or something. So because your health and well-being are important to us, please don't delay your care. If you're having health issues, we want to be sure that you take care of those. So please don't avoid going to physicians, telemedicine or otherwise to manage your care. So just you can trust Banner Boswell and Banner Del Webb Medical Centers that they are very, very safe. To those of you who would like to know more about how you can make an impact and experience the joy of giving to this or other campaign healthcare initiatives, give us a call. And I'm meeting a lot of our friends some who are on this call. We're meeting over at Boswell and to look at the new donor wall so you can take a picture of your leaf. So we'd love to join together with folks who want to see their leaf on this gorgeous wall. And I believe the interactive screen about impact stories is about to be completely finalized and uploaded so we can look at those as well. Again, great to see all of you on the call today. You're looking good. This is a very good looking group here today. As we sign off, I'd like to just say, please stay well, stay safe, and stay connected. Thanks for joining us, and we'll see you next time. Bye-bye.
Thank you.
Thank you.